Greetings. Let us learn about biliary brush catheter, otherwise known as cytology brush. And as you can see here, the structure of a cytology brush is similar as far as the handle is concerned. Thumb ring and a forefinger and middle finger ring. And if you close your hand after holding it, the brush goes into the catheter, and if you open your hand, the brush goes out of the catheter. So here is the brush, and the brush has a spring tip so that there is not going to be any damage as you open and close the brush. In addition, there is a guide wire port that allows us to pass the cytology brush over a guide wire. So cytology brushes are used whenever we look at a stricture and think it is cancer, and that's when we use the cytology brush. We also use cytology brush in patients with primary sclerosing cholangitis, and these patients are at risk for developing cancer, and those strictures are also brushed for brush cytology. So now let us look at how do we go about using the cytology brush in a patient with CBD stricture, and what are the steps. First step is we need to pass the scope in, and we need to cannulate, document the stricture, and pass a guide wire above the stricture, and over the guide wire pass the brush catheter in to just above the stricture, and then we request the assistant to get the brush out. And when we ask that, the assistant, what he needs to do is holding the handle the way it should be held between the thumb and the two fingers, and open the handle. The brush comes out, and the endoscopist uses vigorous movement to brush that area. And some people say brush out, and then that as the brush goes through the stricture, it will brush some cytological specimens and then brush in. And this process is repeated at least 2 or 3 times so that to get enough specimen. And after that, once the brush is in the catheter, we do exchange the brush catheter over the wire, and then following that, typically a stent is placed across the stricture to drain the bile duct. Coming to the adverse events of brush cytology, pretty safe, but the risks with any intervention could be perforation, bleeding, cholangitis, and pancreatitis. Hope this is useful. Thank you.